All right, today is World Cancer Day, and it is commemorated to save millions of preventable deaths each year by raising awareness and education about cancer and pressing governments and individuals across the world to take action against the disease. Cancer is the second leading cause of death in the world. Globally, about 1 in 6 deaths is due to cancer, and about 70% of deaths from cancer occur in low and middle income countries. This means that countries like Nigeria will have to revamp its health sector to ensure that adequate care required by patients can be provided to reduce cancer deaths. The theme for this year's World Cancer Day is I Am and I Will. That's what we're talking about right now. Joining me in the studio is Dr. Oladapo Shiyombi, epidemiologist and member Association of Public Health Physicians of Nigeria. And also have here in the studio Dr. Emil Kun, Secretary, Nigeria Medical Association, Lagos chapter. Nice to see you. Nice to have you both in the studio.
Good morning, Mike.
Yeah, exactly. And also on...
Good morning, Mike.
Thank you very much, Dr. Ashiyombi. Now, let's start from the studio, Dr. Kun. I'd like to start with you on this. Now, when you mention cancer, the feeling is a very severe situation, and the world, United Nations, has seen it as important enough to set a day to commemorate, to draw attention to the awareness of it and prevention and all of that. Talk to us basically, over the years that the day has been set aside this way, how much impact has that had on the awareness about cancer and how to prevent it so far?
Thank you very much for having me. So World Cancer Day, 4th of February, is set aside to create awareness on cancers. We know what cancers are. They are abnormal or uncontrolled growth of cells in the body, any part of the body. So anywhere in the body where you have an uncontrolled growth of cells, whether it's in the lung, whether it's in the cervix or in the womb, you name it after that part of the body. So it's like a silent killer in the sense that if you don't go to get screened, you may not know it exists. So this is a day that is set aside to create awareness and tell people about the symptoms and signs, those warning signals, those things that you can see that will make you to feel, could it be cancer? Cancer, unlike some other diseases, you cannot say this is the cause. Because when you say something has a cause, that means it has a cure. But we have associated factors. For example, smoking. You can't say lung cancer is caused by smoking because some people smoke, they don't have lung cancer, while some have lung cancer and they never smoked. So we have associated risk factors. So these are the things that we bring to fore on a day like this to be able to tell people and sensitize them. Because since it doesn't have that shouting symptoms like that, it is when you get screened that you get to know. So this is an opportunity for us to speak out and let people know. And from the statistics, 1 in 6 deaths is caused by it, and that is more than if you combine the deaths caused by tuberculosis, HIV, and malaria, all combined. So it's actually quite alarming, and it's something that we need to draw attention to.
All right, Dr. Ashiyombi, let me come to you on this. When it comes to the awareness about cancer, people have heard about cancer, but the details of it, of how to prevent it and how to manage and how to report in case of all of these things, it seems that information is still not very out there. Talk to us basically when it comes to preventing cancer. What are the daily things people should know about these?
Yeah, all right. Incidentally, I was just putting up a thought that I've had in the last 1 hour into something that people can take home when it comes to cancer. And I tried to use an acronym called STOP Cancer. Now, first, S stands for stop smoking, little or no alcohol. T, take healthy foods, more vegetable, fruits, whole grains, less processed red meat, flour or fat. Openly discuss cancer the way you discuss malaria. It has physical causes. or associated factors, and it also has treatment if you start early. Place value on your health, meaning check your numbers. For men and women, the size of their abdomen is important. 39 inches for women, 41 for men, if you put a tape across your navel. Your weight to height ratio should be between 18 and 25. And for some cancers, it has prevention by vaccination, like cervical cancer. And like Dr. Okun said, please screen for cancer. That's how to place value on your health. C, care for others. And we ask that people should support, and government should also increase the investment in the health sector to make the primary healthcare system work and things will go well. So we need more CSR. We need people who have cancers to be supported financially because it is expensive. And we also need the health insurance to work for us. Now, for general people, please, if peradventure people are diagnosed of some cancer, please accept that diagnosis and seek care quickly to prevent the disease from spreading and becoming uncontrollable. Now, also, please do not look for information from people who do not know. So, no social media information, seek from people who understand it. See if cancer is not a death sentence, especially if you manage it early. E, exercise. A minimum of 30 minutes of fast walk 4 times a week will help your body. And R, resting is essential. Adequate sleep, at least 6 hours a night. Rest at least once a week, and take holidays. Do not postpone them. That's all I have for Nigerians on that.
That's amazing. I like the issue of rest there. Dr. Ko, you were smiling.
In Lagos,
but I wonder if we have to face the realities of the issue of rest when everyone is hustling, and the amount of your hustling is how much you get, especially for those who are out there who are independent and all of that. How realistic are the issues of rest?
You have to. You just have to consciously make out time.
Okay.
I saw something on social media recently that says if you don't pick a day for your body to rest, your body will pick that day for you, and that day may not be a fantastic one for you.
It won't be convenient for you at all.
Exactly. It's better you pick it up yourself and do it consciously. I know in Lagos, yes, everybody wants to hustle. We're always on the move and all that. But honestly speaking, health is wealth. If you're down, then you realize the importance of being strategic and picking out a day to
and
rest.
being
It's
intentional about it.
Intentional, that's the word. Thank you.
All right, now let me stay with you, Dr. Kundi. There's a report that Nigeria doesn't have more than 5 or even up to 5 public radiotherapy in the country. When it comes to the investment by government, whether federal, state, or local government, whatever it is, in the treatment, management, and all of that issues around cancer, how serious and how far from the standards are we?
Well, that report is quite correct, painfully or sadly so, and that is why we in public health community medicine always advocate for prevention. Since we know the kind of healthcare systems that we run, it's better for us to prevent rather than wait until it gets to that. If you know the number of people that have been diagnosed of cancer at a very high level, as in an advanced stage, and they're on the queue waiting for radiotherapy, we'd rather not get to that level. Like Dr. Dapo said, early detection is key. We can go a whole long way and improve survival rates with this. So that is the true situation of things, really. We can improve on that, but like I am a public health physician, I always want to advocate for more of prevention. I don't want you managing to improve your quality of life when you could have actually prevented it from getting to that stage.
All right. Oladapo, let me come to you on this. The point there is, when it comes to the issues of medical checks, it is not in the everyday habit of an average Nigerian. That's not to say there are no people going for medical checks regularly, but an average person sometimes go to the hospital only when they feel a certain way. And when we're talking about cancer, and from what both of you have said and other medical people have said is you're supposed to have periodic checks, whether you feel good or you don't feel good. You're supposed to just check to know how you're feeling. When it comes to that habit of checking, how should we imbibe that? Talk to us about this.
All right. When it comes to a habit of checking, it's usually age-related. Exactly. So what you look for in a child of 1 year will be different from what you look for in an adolescent of 12 to 15 and what you do for them. And because we're talking about cancer, for example, cervical cancer is sexually related. Now, because most of it is caused by a virus that is sexually transmitted, a human papilloma virus. So what does the world do? They give vaccination to teenage pre-sexual age. So usually between 9 and 14, male and female. So you see, when you are looking at a young child, a young adolescent, the question will be, have you had your cervical cancer vaccine? No, then you take it. Then you move on to the older age group. The lesser the amount of sex you have, the less likely you have cervical cancer. So what you'll be promoting there is, please, as much as possible, there shouldn't be premarital sex so that they will not be exposed earlier to cervical cancer. Now, move on to the adult age group. Of course, then you now start having the different types of adult cancers, the colon cancers, the breast cancers. So for the women, we say do your pap smear, do your mammogram, because those are the two most common cancers in women.
All right.
For the men, when they're about 35, 40, they should also screen for prostate cancer.
Okay. All right. Well, it's good to have these understanding. But, beside the medical issue, like what Oladapo has said, when you're talking about premarital sexual activity and being active and all of that, is a social issue that a lot of people are going to debate against it. Because there's some people who say when there is no activity like that, sometimes you're also prone to other things.
Actually, for sexually transmitted diseases, we talk about the ABCs.
Okay.
Abstinence, be faithful to a faithful partner.
Oh, great.
Because you can be faithful and your partner is not. So we still
He
go
exposes you to the same thing.
So be faithful to a faithful partner. Then the C is the correct and consistent use of condoms. Okay. So he has mentioned one part, the A of the abstinence, but that's the other part, B and C, should be advocated to. And talking about the habit of checking yourself, how about giving yourself a treat every birthday of yours? Yeah, we actually do that in my hospital.
But the issue of treats, the moment you talk about give yourself a treat, there's one feeling you have in your mind sometimes.
Vacation,
where
somewhere?
Apart from that, there's a lot of confectionaries, there's a lot of fries, there's a lot of junks.
No.
And all of you are saying we should stay away from junks.
You should go green.
Okay.
Take only fresh, because it's inside this junk. You have the preservatives that expose you to what we want you to avoid. Yeah. So the treat I'm talking about is walk up to one diagnostic center, put yourself under one MRI or something, screen yourself and get to know that this is my body. I feel good. Is it really good inside? Is there anything I should be careful about and all that? If you do that once a year, on your birthday, just pick that special day. That's okay. Aside eating, going out and all that.
We're learning a new one from you today, Dr. Kun. So the treat is not going to eat cakes and all of that. Alone. Okay, fine. Go to a medical facility and have yourself checked. Yeah. All right. Oladapo, let me come to you on this. The point there is, the report we read earlier says that about 70% of deaths from cancer occur in low and middle income countries, and Nigeria fall in this bracket. Can you explain to us some of the factors responsible for this? Why are low and middle income countries prone to issues of cancer?
All right. I will put it under just one heading, then I will explain that. We have a weak health system. And our health system is based on primary, secondary, and tertiary. So most of the things that should have been done, health education, vaccination, exercise help and all that should have been done at the primary care level, and the screening, so that people will not need to come up with cancer. Secondly, and then because of that, it is expensive for people to do this annual check. I mean, if the 90 million Nigerians live on less than $2 a day, it's going to be challenging for somebody whose annual income is in the region of 733 naira to go and do a test that will now cost him like what, 30, 40, 50, 60,000. So the reason is that people don't do this check because the health finance is weak, the PHC system is not funded properly, and therefore when they now have the disease, most times it's advanced. It's now even more challenging to afford. Like you said, we have only 3 radiotherapy centers. So, and you don't want to know the number of oncologists we have who can treat, that's cancer treating specialists. I'm not sure they are up to 1,000 in the whole of Nigeria for 200 million people. So put that all together. Now, coupled with our social behavior of thinking that cancer is a death sentence. So when people get cancers, instead of them to seek treatment early, socially, it is not their portion.
I just said that.
Then they seek information. Socially, they seek information, they seek cure from the wrong places. And therefore, at the end, put all this together, you now have a high cost of death, of poor outcome.
It becomes compounded.
For cancers. Thank you very much.
Okay.
So what we need to do is invest in the health sector, especially the primary care system, and ensure that people have access to health. And that takes the right leadership and governance.
Okay.
Thank you.
All right. Thank you very much, Dr. Oladapo Ashiombi, epidemiologist and member, Association of Public Health Physicians of Nigeria. We really appreciate you. Thank you for talking to us. However, we still have Dr. Emil Kuhn with us here in the studio. Now, we see that the health insurance, most of it doesn't cover cancer treatment and cancer management and all of that. And experts are pushing for that. How challenging is that? And why is it like that? Let me say.
Well, the cost of treating cancer is quite high, and sometimes you can't tell how long you're going to take that treatment for. So, and the way the health insurance runs, it's everybody contributing so that when a particular person or a group needs it, so it would look as if it's unfair that because of one particular ailment, which is gulping much more than something like maybe malaria or so. But then this is with us. The cancers are there, and we just got to address it. Paying out of pocket for cancer treatment could be quite devastating for an individual. And that is why, because in low and middle income countries, we don't have that good structure of health insurance. That is why you find out that the prevalence is higher in this part of the world. So a lot of people are advocating that we can find a way around it, because you can't wish it away. It's here already. The cancers are here. So we can't wish it away. What a better way to add value to our populace if we cannot do this to assist. So.
All right. So on a day like this that we're commemorating World Cancer Day, what kind of activity should we be embarking on today?
Okay, so because of the COVID-19 pandemic, since we're advocating for screening, we would have loved a situation where we do massive screening for people, testing for people. People usually do that as CSR, work with organization, NMA partners with organization to screen people in a particular location, LG or something. We prefer to go to rural areas because those are the places that are a bit hard to reach and the awareness creation may be a bit poor, so we like to go to places like that. But because of the COVID-19 pandemic and the reducing crowd and contact, we're doing more of social media awareness like this. We're having webinars and talks and all that, hoping that very soon we'll still be able to do this. But a pocket of places like hospitals are doing the screening while maintaining the COVID-19 protocols, but you won't have like mass gatherings like you set up canopies in an LG and invite everybody, because your intentions might be good, but people at the end of the day, and especially because you're likely to do it for free, you know, they've been looking forward to that, they might just railroad the COVID-19 protocol. So some hospitals, pockets like that, are still doing that to mark this day.
All right, it's quite interesting. The presence of COVID-19 has complicated, like you said, how people should respond, and organizations should respond to these things. But let's talk about the issue of habits, daily, everyday habits that can prevent. I know Dr. Oladapo mentioned it earlier, but for emphasis, what are the kind of things we should do on a daily basis from when we wake up to the end of the day, for a typical day, for instance?
Okay, so for the habits, we mentioned exercise. We talked about brisk walking, minimum of 30 minutes, at least 3 to 4 times in a week. So it's like alternate days. Then we talked about food that you eat. You go green, fresh, avoid junk because you don't want processed food. Then maintaining healthy weight and avoid nicotine. I've hardly seen any cancer that's not associated with smoking. Almost all the cancers, you will see smoking associated with it. So these are the habits that we can avoid, and those ones that are good for us so that we can prevent these cancers.
Okay.
Thank you very much.
Thank you so much. We have to leave you here now. Dr. Ime Okon, Secretary, Nigeria Medical Association, Lagos Chapter. We appreciate your coming on the program.
Thank you, Mike. Have a wonderful day.
And you too.
Bye.
Thank you.